start. I think this is really, I don't have the details, but when I went to the basketball game with the president, the prime minister went with me. No, he didn't go with me, he went with the president. I said, well, okay, let's make it clear. So, we're watching the game, of course, and somebody shoots an air ball. And I look at the chief of staff of the prime minister, I said, well, you know, we call that an air ball. And he says, yeah, I read about that. Then a few minutes later, we come down the floor, they make a pass, and the guy dunks it, and the guy looks at me and he says, that's a slam dunk. I said, you got it right. So I got his card. I said, my family's going over to London for spring break. He goes, oh really? Why don't you have them come by and go to 10 Downing Street, which I've never done. I thought it'd be really, really cool. My wife just texted me, they went to 10 Downing Street, and guess who met them? The Prime Minister. Wow. Isn't that a great story? So anyway, we're not here for that. All right, go ahead. Speaker first. So Governor, your staff told me you know how to call an audible, so well done there. So look, I'm Michael Fisher. I'm the President and CEO of Cincinnati Children's Hospital Medical Center, and we're here today really representing my colleagues from the Ohio Children's Hospital Association. And it is my great pleasure to introduce the Governor of the great state of Ohio, the Honorable John Kasich, our Governor, who has a profound optimism for our great state and has a deep background in public policy, having served both in the Ohio General Assembly and as Chairman of the U.S. House of Representatives Budget Committee. And Governor, as somebody who also came from the private sector, we admire your strong background in the private sector as a business leader who understands what it takes to make business successful, the importance of making sound investments, and most importantly, how to sustain and create jobs. Your experience in the public and private sectors have given you a unique insight into how to develop solutions. I think that's the operative word, solutions to the challenges we are facing together. Governor, the children's hospitals in Ohio applaud your leadership and your challenge, and especially your encouragement to all of us, to develop a health care system that focuses on improving outcomes and reducing costs. You know, 1 out of every 2 patients that come through our doors in the children's hospitals is enrolled in Medicaid. So we take very seriously our role in improving Ohio's health care delivery system as Ohio's largest Medicaid providers, as it directly impacts the state of Ohio and the Medicaid program. Governor, Ohio's children's hospitals are leading the country in patient safety and quality improvement. And I agree with you, in the world. In fact, together in a collaborative spirit by working together, and I think, again, this is really one of the themes, the collaboration. We are transforming how pediatric medicine is delivered in our country and, as you said, around the world. Under our Ohio Children's Hospitals Solutions for Patient Safety Learning Network, we have saved over 7,700 children, Isaiah, 7,700 children from unnecessary harm, and have saved the system over $11.8 million in health care costs, and we're just getting started. This important work, which is supported by many of Ohio's leading businesses, like AK Steel, like Cardinal Health, and foundations across the state, is making a huge difference. We're now exporting this unprecedented work to other children's hospitals across the country to improve outcomes and reduce costs. In fact, 2 weeks ago, right here in Columbus at Cardinal Health's headquarters, our OCHA team hosted 34 children's hospitals CEOs, board members, patient and quality leaders to export and expand this very critical work. We have a vision that I know you share, Governor, and that is to make Ohio the safest place in the country for children to receive health care. Our hospitals directly provide 28,000 stable, high-paying jobs for Ohioans, and we have made Ohio Pediatric a health care destination. We're privileged to provide care to families from all 50 states and dozens of countries from around the world. And in fact, I think Ohio Jobs Director Kwame might even call Ohio's children's hospitals a strategic economic cluster. Ohio Children's Hospitals are also the leaders in pediatric research, more to the point of today's session. Leaders in pediatric research in the United States of America, bringing in more than $245 million each year in the form of National Institutes of Health, federal grants, and other research just last year. And that's more than any other state.
So the state of Ohio brings in more pediatric research dollars than any other state. We're proud to join you today to announce the 2 research projects we are proposing that will directly benefit Ohio children in a very impactful way. Before I welcome the governor back up to the podium, I do want to acknowledge that Governor Kasich is a devoted husband to his wife Karen and a devoted father to their twin daughters, Emma and Reese. And so we know that your leadership and your commitment on these issues, which is true for virtually all of us, stems not just from business, not just from your governor leadership role, but it stems from that unique responsibility and that unique hope that we as parents share for all children. Governor, thank you for challenging us and for fostering an environment where collaboration is recognized and rewarded. We're proud to partner with you and our elected officials and your team to improve the Medicaid value proposition. Ladies and gentlemen, please join me in giving a warm welcome to the Honorable John Kasich.